Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today I'm going to discuss about ICD-10-CM Chapter 2 Neoplasm. For the Neoplasm code range is C002D149. So I'm just going to explain the guidelines with questions. So let's begin. So today I'm just covering introduction to neoplasm and the overview of chapter 2 and the code range, and then classification of neoplasm, that we have different kind of neoplasm based on the severity: benign, malignant, in situ, and uncertain behavior, and again metastatic. So everything we will learn in later slides. Next, I have added general guidelines for coding neoplasm and definition and classification, and also specific coding guidelines for primary malignant neoplasm, and I have just added example with each guideline. And again, specific coding scenarios like admission for encounters like chemotherapy, hydration. Okay, so we will learn everything in detail. So firstly, let's understand general guidelines for coding neoplasm. So as we know, chapter 2 of ICD-10-CM coding system is dedicated to the classification of neoplasm. So we have a separate chapter for neoplasm, that is chapter 2. And what is neoplasm? Neoplasms are the abnormal tissue growth that can be benign, that is non-cancerous, or it can be malignant, which is cancerous, and it is essential to accurately determine the nature of the neoplasm from the patient medical record. So as we medical coders, we have to first find out the provided documentation is what, whether they are talking about benign neoplasm or malignant or metastatic. Based on that, we have to code it accordingly. Next, we'll understand the classification of neoplasm. The first one is benign neoplasm. Benign neoplasm, as I said earlier, which is non-cancerous, and usually it will not spread. Coming to malignant neoplasm, which we call it as cancerous, and it has the potential that it can invade the surrounding tissues and it can cause like the metastatic will be there. Okay, it can metastasize the other part of the body. And then next, in situ neoplasm, tumors that have not invade neighboring tissues. And uncertain behavior, neoplasm that do not fit clearly into benign or malignant classification. So the provider, he couldn't determine whether the neoplasm is benign or malignant, then we will consider it as an uncertain behavior. Then as we know, metastatic refer to the spread of cancerous cell from the original site, and then it travels to other part of the body. Okay, when cancer is described as metastatic, it means that cancer has already advanced beyond its initial location and formed new tumors, that is called metastasis. Okay, so how it will travel? So from the initial site to a secondary site, it can travel through bloodstream or lymphatic system and establish a new growth of other areas. Okay, so these are the classification of neoplasm. So now let's understand the code set for each neoplasm classification. So the first one is malignant neoplasm. In that, primary malignant neoplasm code range is C002 to C75. Next, secondary or metastatic code range is C76 to C80. Then malignant neoplasm of lymphoid tissues, it is C81 to C96. Next, in situ neoplasm, here in situ, which is non-invasive, D002 to D09. And benign neoplasm by site, we have code range from D10 to D36 series. And then neoplasm of uncertain behavior, neoplasm with uncertain behavior by site, D37 to D48. And neoplasm of unspecified behavior, it is not an uncertain behavior, but it is an unspecified behavior. This provider will document. So neoplasm with unspecified behavior by site, we have D49. Unspecified behavior of skin, likewise we have more example. So that time we will code with a D49. So next, the first coding guideline regarding to properly code the neoplasm, identify its classification. As we discussed already, we have to find out the classification first, whether it is benign or a malignant or in situ or metastatic, to code appropriate code. Say for example, if patient is diagnosed with a malignant tumor of breast that has spread to lymph node. Okay, so initially primary cancer was breast cancer. Later, it traveled and it spread to the surrounding tissue, which is lymph nodes. Okay, so now we have both primary cancer and secondary. So just with irrespective of sequencing, I'm just mentioning the code. Malignant neoplasm of breast would be C50.9 series, and based on laterality we will give the code, complete code. Next, secondary malignant neoplasm of axilla of upper limb lymph node. Okay, again this for metastatic C77.3, and we will check the laterality whether it is right axilla or left axilla. Based on that we can give the code for secondary site. Okay, so this is how we have to first identify what kind of cancer it is. Okay, next coding guideline is primary malignant neoplasm overlapping site boundaries. So if primary malignant neoplasm overlaps two or more contagious site, use the subcategory code that is 8. It will end with 8. Okay, saying that overlapping lesion, unless a specific combination is indexed elsewhere. For this specific combination, so if you take a breast example, so if the provider is documenting the malignancy was found in the 12 o'clock position or 6 o'clock position, okay, where it can overlap with the two quadrants. Okay, it can overlap with the upper quadrant and lower quadrant, so that we will be assigning single code C50.812. Okay, 8 series, C58 series. And one more guideline, for a multiple non-contagious tumor in the same organ, each tumor is coded separately. So patient is having on breast only two non-contagious tumors. So example here, tumors with a different quadrants. So one tumor is on the right upper quadrant and one more tumor in the right lower quadrant. So that I have to code two different codes according to the quadrants. Upper quadrant one code I will code, and again for lower quadrant one more code I will code. Next, malignant neoplasm of ectopic tissue. So malignant neoplasm originating in ectopic tissue are coded to their site of origin. So what we will do, once they see ectopic, we will find the primary site, the original site where it got formed. Okay, so example, ectopic pancreatic malignant neoplasm involving the stomach should be coded as malignant neoplasm of pancreas. Okay, so though it was started from pancreatic, it was already traveled to stomach also. It involves stomach. But here we are coding pancreas. Okay, as a origin, like a original site. Next, neoplasm table reference. So whenever we are coding for neoplasm, first always start with the neoplasm table in the alphabetic index. So we all know we have a separate table to find the neoplasm codes, okay, in the book also. But it is what is the best practice is we should always go and refer the main term in alphabetic index. Later, like as you can see, if you are searching for carcinoma, it will give you an instruction like see also neoplasm by site malignant, and if you are searching for adenoma, it will give instruction like see benign. Okay, so that according to that you can come back to the table and you can take the codes accordingly. So here for documentation, adenoma of colon, so adenoma will lead to benign condition, so that we will code benign neoplasm of colon. So next coding guideline, the specific coding scenarios, admission encounter guidelines. So admission for primary site treatment. So whenever patient is admitting for primary care or a primary site cancer care, then we will be assigning our primary cancer as primary DX, first listed diagnosis. Okay, unless chemotherapy or radiation therapy are the primary reason of admission. So if the exception here is if patient is admitting anything related to chemotherapy or radiation therapy, then we will code that chemotherapy or radiation therapy first listed. We will keep them primary. Secondary, we will give the cancer. Okay, if patient is not coming for chemotherapy or radiation therapy, he is purely coming for primary malignancy treatment, then our first ICD should be cancer as a primary diagnosis. Next, admission for secondary site treatment. Here, if treatment is directed to a metastatic site only. So, if provider is admitting for secondary site treatment and provider is giving treatment towards metastatic site, here we will code our secondary cancer as our primary diagnosis, followed by secondary we will keep primary diagnosis. Okay, so if the treatment is directed to metastatic site only, secondary neoplasm is coded as principal diagnosis. Okay. Next coding guideline is complication associated with malignancy. So here anemia associated malignancy, whenever patient is having anemia with malignancy and patient came for to take the treatment towards anemia. Okay, patient came for anemia due to malignancy or associated with a malignancy and anemia being treated. Okay, only anemia they have treated. That time we will code our cancer code as a primary diagnosis and secondary we will be coding D63, that is anemia code. Okay, so next coding regarding anemia only. Here anemia associated with chemotherapy, immunotherapy and radiation therapy. So when the admission or encounter is for management of anemia associated with any adverse effect of the administration of chemotherapy or immunotherapy. Okay, so here anemia is due to adverse effect of chemotherapy and immunotherapy. So here what we will be assigning first, in this case we will be assigning anemia code primary and secondary we will be using the adverse effect code. Okay, so primary should be coded as anemia code and secondary we will be coding adverse effect code. Okay, but when patient come for anemia associated malignancy and taking treatment towards anemia, the first primary code should be our cancer, then we will be coding D63. Okay, so when anemia associated with the adverse effect from chemotherapy or radiation therapy, here anemia will be coded first, secondary adverse effect we will be coding. Example, if patient is admitted for a treatment of anemia associated cancer and taking treatments to anemia, so we'll be coding neoplasm or malignant neoplasm first and anemia second. Next guideline, management of other complications like dehydration. So if dehydration is due to malignancy and it is treated, dehydration being treated, then we will be assigning dehydration as a primary code and secondary we will be using the malignancy code. Okay, example, if the primary reason for admission is dehydration, you will be coding dehydration primary and secondary we will check whatever the cancer it is, according to that we will be coding the secondary diagnosis. If it is breast cancer, we will be coding breast. If it is gastric cancer, we will be coding gastric. Likewise, whatever the cancer, that should be coded secondary. Next guideline, previously excised primary malignancy. So here the provider should mention that there is no malignancy. The malignancy has been completely cured. Okay, so that time you can use the code from category Z85 for the personal history of malignant neoplasm. And when there is no further treatment or evidence of malignancy at the site. Okay, the patient should not take any treatment towards that malignancy and also there should no evidence Okay, then only we can use the history code from Z85. So if patient had a malignant melanoma excised, the appropriate code would be. So we'll be just assigning the personal history of malignant neoplasm. Special cases in neoplasm coding. In that, the first one is malignant neoplasm in pregnancy. So if pregnant woman having malignancy, we will be coding O series as a primary diagnosis, that is from chapter 15, and secondary we will be using the malignancy type code. Next, a disseminated malignant neoplasm unspecified. So we will be using C80.0 for the cases with widespread metastatic disease where no primary or secondary sites are specified. So primary site also unspecified, secondary site also unspecified. So that time we will be using a disseminated malignant neoplasm, that is C80.0. Next, malignant neoplasm without specified site. Here we will be using C80.1 when what is the case? When primary site cannot be determined. Okay, so you might have a secondary site but you don't have a primary site. Primary site being unspecified. That time you will be using C80.1 malignant neoplasm without unspecified site. To give the primary code, you can use C80.1 with the metastatic site code. Next, aftercare, follow-up and history. Again here also we have so many guidelines, but I have just simplified and added the important thing. The first one says aftercare following neoplasm surgery, we have to use code Z85 to represent history of malignant neoplasm and if treatment is completed. Okay, say for example, patient who had a colon cancer surgery with no further treatment is required. Okay, the further treatment is not required, it is fully cured. That time we will be using from the code range Z85038 to indicate the personal history of malignant neoplasm colon. Next, prophylactic organ removal. So if prophylactic removal like mastectomy due to genetic risk, so we will be taking code from Z40 series. So here I have added Z40.01 which says encounter of prophylactic removal of breast as a primary code. Okay, so whatever the organ being removed for the prophylactic purpose, it will be coded primarily. So next, I've added just a practice question, guideline based. So you can see here, these are the very basic questions. Which of the following defines a malignant neoplasm? So as we know, the answer should be the tumor that can invade surrounding tissue and metastasize. Okay, so that is called malignant neoplasm. Malignant neoplasm are the cancerous cell which spreads the surrounding tissues. And when coding overlapping malignant neoplasm, what code should be used? So here, which code should be used? It should be, answer should be B, 8. Okay, we will be using category or subcategory as 8. Next, in which scenario should the principal diagnosis be the metastatic site? So when treatment is towards metastatic, we will be coding metastatic code as primary. So coming to this option here, if you see the option B, when patient is admitted for a lung metastasis from the breast cancer. So primary cancer is breast cancer. Due to breast cancer, patient developed lung metastasis. So currently patient is taking treatment for lung metastasis. So that we will be using metastatic code as primary code. Next, if we can add the primary site as a secondary code. Next, what should be coded if malignant neoplasm has been previously excised? Okay, so if it is already excised and if it is completely cured, we have to code it as a history. The history of malignant neoplasm. So we should have the documentation where they specify that has been completely cured or there is no evidence. Next, when coding for a complication related to malignancies, which of the following is considered? Okay, so we have a separate coding guidelines, complication related malignancies, that is complications such as anemia and dehydration. So what is the guideline? If patient is coming for anemia associated with a malignancy and taking treatment towards anemia, so the first guidelines is we will be coding malignancy primary, secondary we will be coding anemia. And one more guideline regarding anemia is when patient is coming with anemia due to adverse effects from chemotherapy or radiation treatment, here we will be coding anemia as primary, and secondary we will be coding our adverse effect. And coming to dehydration, when patient is coming for dehydration associated with a malignancy and provider has treated the dehydration, then our primary code would be dehydration. Secondary, we will be coding the whatever the malignancy or whatever the cancer code is there, we will be coding that. So answer is B. Next, what is the correct approach when coding neoplasm associated with the transplanted organs? So I did not explain this guideline. So we have a specific coding guideline for complications associated with the transplant organs. So for this we have to use answer B, code the complication related to the transplant organ. So we have to identify what is the complication from the transplanted organ and we will be coding it. Seventh question, when using the neoplasm table, what is essential to determine? Okay, so you are coding a medical record where you are dealing with the neoplasm cases. The first thing that you have to determine or identify is what type of neoplasm it is. Okay, the histologic behavior of neoplasm, whether it is benign or malignant, in situ, metastatic, that we have to identify and accordingly we have to code. So again the answer is B. I have just added all the answer B. Next, what coding guidelines should be followed for leukemia? Okay, so here we have to code based on the type of leukemia and its stage. So we'll check the type of leukemia and we'll be check the stage of the leukemia and we will be coding according to that. So yes, that's all for today. Thank you all. Thank you for watching. Please do like and share with your medical coding friends, and please do subscribe to my channel.